Dear esteemed colleagues from across the world, greetings from the Indian chapter of the American College of Surgeons. In these gloomy days and difficult times for all of us, there is positivity that we need to have within us so that we can spread it around us. I'll just share with you my information and ignorance in the field and as we practice it in this part of the world. India has its own challenges and is a land of paradoxes. While at one end you may have facilities that can outdo the best in the world, and at the other end we are struggling with the teeming masses and the surgeons are practicing in backwaters. And to all those colleagues and the frontline warriors, I salute you. Our age-old tradition of saying namaskar to everybody was based on the same logic, that I bow before the divine spirit within you. So clearly it shows that the divine spirit that lives amongst all of us has taught us many things. The first being, everything is so transient, and that shouldn't disappoint us and that shouldn't weaken us. It is good and bad at the same time. If it was permanent, the bad times would be here to stay. And if it was not impermanent, we would be struggling with a very, very gloomy future. So I can assure you, and I'm sure we all know, that this too shall pass. Now I'll just share with you the experiences that we have faced, and as a surgeon at a leading tertiary care surgical center of the country, with part of it completely dedicated to COVID now, we are struggling to deal with the numbers, which exactly is an issue in this part of the world, as I mentioned. But considering that, administratively and as a country, we have done very well, and I'm extremely proud of it. Although we haven't yet seen through it, but the early lockdown did manage to flatten the curve to a degree. The challenges that a surgeon like me will face in a smaller hospital would be more than the ones that I face at my place. Should we go for routine testing? It's too expensive to be affordable in this part of the world. Or will it be right to do it in everybody? Will it be scientifically correct to do it in everybody? Well, these are questions that we need to answer. And do the PPEs or the personal protective equipments really protect? Now, these are issues, especially when one is managing these patients in not so well ventilated places. It may be a challenge to work with these gears on, but that is to be done, and we have done very well so far. And I must join in camaraderie all our fellow colleagues across the globe who have to face similar situations. India can be an example for the rest of the world in that it has started making, lots of people have come forward into supporting the cause by bringing out the PPEs for the healthcare workers who are naturally at a very great risk, and it doesn't necessarily include only the surgeons. From the perspective of a surgeon and as one of the leaders in the field for the surgical colleagues of this country and this part of the world, I personally think the surgeons have a great role to play in actually achieving that balance between leaving some patients that do not need an emergency surgery. Getting back to the concept when we had to prioritize and when triaging started way back when Larry did it in a war. We need to really look at the cancer patients with a lot of care. If there is a feasibility of postponing their surgery, and if it is not life-threatening, it can be done. Barring emergencies, we are looking at those patients, especially in the cancer, since the field involves a lot of oncological work, we are not doing routine surgeries for cancer. Is there any routine surgery in cancer? That's a big question that you may ask me. Now, we don't really know which is the bigger enemy, the one that you can see and the one that you may not be able to see or you cannot see. I certainly feel the invisible enemy is worse than a visible one, because the invisible enemy, the only option you have is to hide yourself. And if you hide yourself, you may not be able to do a lot of other jobs. So we are in those difficult ethical days of decision making where we need to pick up between what is life-threatening, what to do and what you don't do. So the do's and don'ts have been discussed. We have come out with guidelines from our own government and also the Indian Council of Medical Research. The ACS guidelines have helped us tremendously in sharing with our colleagues as to how can it be done. The frontline warriors in this field are definitely the respiratory physicians, the anesthesiologists, and also surgeons who are duly dealing with the thoracic part, or those who have to do the head and neck surgery, including yours truly. The challenge here is not all patients of cancer in this region, especially in head and neck, can be put on some kind of a adjunct or some kind of a chemotherapy or radiation, and surgery needs to be prioritized. So we are actually tailoring it to the patient, to the surgeon, to the center and to our problems. The routine COVID testing is not yet being practiced. We are looking at the high risk cases, especially those who have traveled or those who have a history of being in contact with those who have traveled. India is a huge democracy which is multi-racial and multi-religious, and there are people who do not agree with certain things, and in a democracy you need to take all the people along, including those who don't agree with you, which is a challenge with its own challenges and its own capability to fight and the undying spirit of an Indian to survive any adversity. I hope we'll be able to cope with it. And I do certainly see light at the end of the tunnel. What is it that we have done specially? We have designed some masks. We have looked at studying whether we can actually offer a middle path for the management of some cancer patients that are actually emergencies. The obs-gynae work, like we all know, cannot stop even if we want to, because the babies will get born, and in this part of the world we have a handful of that problem. The elective surgeries obviously have been stopped. We are looking forward to a time when probably we'll have some practice changing guidelines for all of us. Till such time that we conquer this devil and we are in some fresh light and fresh air, I wish you all the very best. I do know that your challenges are not comparable to the other person's challenge, but I must confess that in this fight we are all together and we have to do it together. And I'm sure at the end of the day we will win. We shall overcome at some point of time. As they say in our scriptures, end of the day it is the spirit that wins. And if the spirit is positive, we are sure to win. Thank you very much, and wishing you all to be safe and blessed. Wishing you all to be completely healthy, which is an old Upanishad hymn from our scriptures, Sarve Santu Niramaya, Sarve Sukhani Bhavanti, which means may all be healthy, may all be happy, may all be joyful, because happiness is physical, joy is spiritual. So we should be at the end of the day hoping and praying that we get over this pandemic, and very soon. Thank you all very much.